The first clue came from blood work during a routine physical.
Good.
More testing and a specialist confirmed it. Sherry Hughes had hepatitis C.
And I went, oh my God, how did that happen? Like, no idea.
Hughes had early-stage liver damage. She still doesn't know how she contracted the blood-borne virus. Decades ago, there wasn't widespread screening of blood products for infections like Hep C. The virus can also be spread through infected needles. Liver specialists are now recommending all Canadians born between 1945 and 75 be tested for Hep C because there are new drugs to treat it.
The government has removed all restrictions for getting access to these treatments. So every infected person with hepatitis C in Canada can access therapy.
The doctors that put out this latest guideline say they do have relationships to the manufacturers of hepatitis C drugs, broadly speaking, but say that didn't influence their recommendation. They also acknowledge there's another task force that doesn't agree with them. A guideline published a year ago, largely for family doctors, recommended the opposite, finding no evidence on the effectiveness of screening unless the patient was showing symptoms or at high risk of contracting Hep C, saying it made sense for injection drug users and sex workers, but not everyone.
We really do not know whether these drugs are a cure. The costs of screening and treatment would have a dramatic impact on our healthcare budget of the order of $1.5 billion.
That leaves patients and physicians between a rock and a hard place.
Family physician Danielle Martin agrees high-risk patients need to be tested. As for everyone else,
We're going to have those conversations one by one in our offices.
and no doubt some patients may have questions of their own. Christine Birak, CBC News, Toronto.